Welcome to PHILA Health Systems of NC, also known as PHNC. We are honored to support you and your family on your journey towards stability, recovery, independence, and a meaningful quality of life. At PHSNC, our care is person-centered, compassionate, clinically sound, and free from judgment. We meet individuals where they are and work alongside them to overcome barriers, build strengths, and move closer to their goals. This short orientation reviews your rights, your responsibilities, and how we work together to support safe, respectful, and effective care. As an individual receiving services from PHSNC, you have the right to be treated with respect, dignity, and privacy. You have the right to receive services without discrimination based on race, color, national origin, religion, age, sex, sexual orientation, gender identity, marital status, disability, health status, diagnosis, source of payment, or any other status protected by law. PHSNC is committed to providing a safe, supportive, and respectful environment where every person is treated as valuable, capable, and worthy of care. You have the right to be informed about the services available to you through PHSNC. You have the right to know where, when, and how to access the services you need. You also have the right to be informed of your service options so that you, your parent or guardian, or your legally authorized representative can make informed choices about your care. Information should be shared in a way you can understand, including interpreter services, translation assistance, or reasonable accommodations when needed. Your voice matters. You have the right to participate in the development, review, and revision of your treatment plan or person-centered plan. This includes identifying your strengths, needs, preferences, goals, natural supports, and desired outcomes. You have the right to ask questions, understand your care, and receive information about your behavioral health needs, treatment options, expected outcomes, and possible risks. You may also request a second opinion about your care when applicable. You have the right to give informed consent before receiving services or treatment. You have the right to approve your plan of care after it has been fully explained to you. You also have the right to refuse care or services and to be informed of the possible risks and consequences of refusal. PHSNC respects your right to make informed decisions about your care. You have the right to privacy and confidentiality. You may request information about your healthcare and behavioral health services. You may request a copy of your medical record in accordance with applicable law and PHSNC procedures. You may also ask that your medical record be corrected or amended if you believe information is inaccurate or incomplete. Your information will be kept private and confidential, except when disclosure is permitted or required by law, contract, court order, audit, emergency circumstances, mandatory reporting requirements, or with your written authorization. You have the right to receive considerate and respectful care in a clean and safe environment. You have the right to be free from abuse, neglect, exploitation, humiliation, retaliation, coercion, and discrimination. You also have the right to be free from any form of restraint or seclusion used as a means of coercion, discipline, convenience, or retaliation. PHSNC works to create an environment where every person feels safe, respected, and supported. If you have a concern, complaint, or grievance, you have the right to speak up. You may use the PHSNC complaint process to resolve concerns. You may also contact your applicable North Carolina Medicaid Managed Care Organization or tailored plan if you believe you have not been treated fairly. You have the right to file a complaint, grievance, or appeal without fear of retaliation. You may also appoint someone you trust, such as a relative, friend, advocate, or attorney, to speak on your behalf if you are unable to speak for yourself regarding your care and treatment. To reach PHSNC, call 704-960. You have the right to be informed about how to access crisis, emergency, or after-hours support when needed. In a medical or safety emergency, call 911. For mental health crisis support, call or text 988. For PHSNC office support, call 704-960-4280. PHSNC serves youth and families with care, respect, and professionalism. Under North Carolina law, minors may be able to consent to certain services without the consent of a parent or guardian, including services related to alcohol or controlled substance use and emotional disturbance. PHSNC follows all applicable laws regarding minor consent, confidentiality, parental or guardian involvement, safety, and mandatory reporting. Just as you have rights, you also have responsibilities that help support your care. As an individual receiving services from PHSNC, you agree to work with us to protect, support, and improve your health, wellness, recovery, and stability. You are encouraged to participate honestly and actively in assessment, treatment planning, service delivery, and discharge planning. Please ask questions when you do not understand your services, treatment plan, rights, responsibilities, or recommendations. We ask that you treat PHSNC staff, other individuals served, families, visitors, and community partners with respect. Please notify PHSNC if you have concerns or problems with any staff member by calling 704-960-4280. Please provide accurate and complete information to the extent possible, including information about health conditions, behavioral health needs, medications, safety concerns, insurance or Medicaid coverage, and changes in contact information. If you have a medical condition that may be contagious or may affect service delivery, please let staff know. Please keep scheduled appointments and notify PHSNC as soon as possible if you need to cancel or reschedule. You are encouraged to invite supportive people to participate in treatment planning when appropriate and desired. Please work toward the goals identified in your treatment plan or person-centered plan. If you wish to end services, please notify your treatment team so discharge planning, referrals, and support can be completed appropriately. When leaving a program, participate in discharge planning, request a copy of your discharge plan, make sure you understand it, and make reasonable efforts to follow it. If you take medication, please take it as prescribed by your medical provider. If you have concerns, side effects, barriers, or feel the medication is not working, promptly discuss this with your prescribing provider or treatment team. Please tell your therapist, qualified professional, peer support specialist, or treatment team when you disagree with recommendations or want to make changes to your services. Your care works best when communication is open, honest, and respectful. Please follow posted rules and program expectations for day, evening, facility-based, office-based, or community-based services. Please be considerate of other individuals served and their family members. We also encourage you to seek and use additional support services in your community when appropriate. Please read or have someone read to you written notices from PHSNC about changes in services, policies, appointments, or program expectations. At PHSNC, we believe that every person deserves to be treated with dignity, compassion, and respect. We are here to support your recovery, your stability, your independence, and your dreams. Thank you for allowing PHILA Health Systems of NC to be part of your journey. C, helping you live your dreams every day.